How do you define contraception? It's a method which allows intercourse but prevents conception. That is, it prevents pregnancy. There are various methods of contraception. You've got temporary methods and permanent methods. The difference is that in temporary method, the effect lasts while the couple uses the method, but fertility returns after discontinuing the method. That is, as long as they're using it, the woman will not become pregnant. But once it is stopped, she can become pregnant. At the ideal time, at their chosen time, she can become pregnant. Now, permanent method is where the effect is permanent. It is surgical methods. We call it a tubectomy in women. Fallopian tube is disrupted. Fallopian tube is cut and ligated in a woman. So we call it a tubectomy. In a man, we call it a vasectomy because the vas deferens is ligated and cut. So these are the permanent methods in which usually the effect is permanent unless a reoperation is done, which may always not be successful. Now, what is the method the couple should choose? The method depends on various factors. You have to take various factors into consideration, like availability of the method. How freely is it is available everywhere? Or does the patient has to go to a hospital for this method? Or is it available, you can buy it anywhere? So then the cost of the method, if it is an expensive method, many couples may not be able to afford it. Age and parity of the couple. Say a very young girl, we do not advocate any intrauterine devices. Similarly, if the woman is nulliparous, if they do not have any children, then we would not like to insert anything into the uterine cavity because we may be introducing infection along with it. So the method chosen will depend again on the age and parity of the couple. Then reliability. How reliable is it to prevent pregnancy? What is the failure rate? If it is a very high failure rate, then it is not advisable to select that method. What are the side effects? Side effects. Say, suppose a woman is taking hormonal contraception, then side effects of the drugs will be there, like say gastrointestinal side effects or effects on the carbohydrate metabolism, etc. Then contraindications. Some methods are contraindicated in some conditions. Say an IUCD, intrauterine device is contraindicated if there is genital tract infection, or hormonal contraception is avoided if there is woman has hypertension or diabetes. So you have to consider the contraindications also. Then what are the advantages and disadvantages of the method? See, some methods have additional advantages apart from contraception, which I will tell you in detail later. And then the necessity to follow up the couple, but to know whether any side effects are there or any disadvantages are there, whether it is effective or not. All this also makes a difference in choosing the ideal method for contraception. So when a couple comes to the gynecologist for choosing a method, you have to counsel the couple, explain the advantages, disadvantages, side effects, contraindications, etc. of the various methods, and allow the couple to make a choice. So, what are the methods? You got natural methods and you got the devices for contraception. Now, what are the natural methods? Natural method is where you don't use any device. They are one, abstinence during fertile phase. That is, at the time of ovulation, the couple must abstain from intercourse. Second method is the withdrawal. We also call it a coitus interruptus. Third method is the breastfeeding. Now, the other methods where devices are used for contraception are barrier contraceptives. In barrier contraceptives, you have got condoms for the male, spermicidal agents which kill the sperms, a diaphragm, cervical cap, female condom, etc., which are placed in the vagina, which prevent the entry of the sperms into the cervix. Then a vaginal sponge, the trade name is today. This vaginal sponge also acts as a barrier. Then you've got intrauterine contraceptive devices where a small device is placed in the uterine cavity. Suppression of spermatogenesis. Agents are used for suppressing spermatogenesis. Then suppression of ovulation, hormonal contraceptives, what is commonly called the pill or oral contraceptive pills, they suppress ovulation. You got interceptive agents. We also call it postcoital contraception. This contraception, these methods are used in a couple who have had unplanned intercourse, and then they're afraid that the woman may have conceived. And the devices that are used are called postcoital contraception. Interception, that is, they intercede with the implantation of the fertilized ovum. They may not always prevent ovulation, but they interfere with the implantation of the fertilized ovum. Then immunological methods, where antibodies are used to act against the sperm or the ovum and destroy it. Then you got the surgical methods, which are permanent methods. So I have enumerated the various methods for contraception, and all these methods I will be dealing with in detail in the next few classes. This may take about 4 or 5 classes to deal with them. Right. Now here you can see the various methods. This is the condom, male condom. These are OC pills, oral contraceptive pills. This you can see, this is a patch which is stuck on the skin, which releases hormone. This is the female diaphragm and cervical cap. This is a vaginal ring which contains hormones which are released daily. This, okay, so all these various methods you can see here, pictures. Again, these show the same thing. You can see the pills. This is a diaphragm, condoms. This is another type of pill, etc. Now, first I'll talk about the natural methods. Natural methods are, I told you, abstinence, coitus interruptus, and breastfeeding. Now, abstinence is avoiding coitus during the fertile phase, that is at the time of ovulation. Now, how to know what is the time of ovulation? How to decide which is the fertile phase? There are 3 methods to predict this fertile period. One is a calendar method, also called the rhythm method. Here we assume that a woman has a 28-day cycle, menstrual cycle, and in this woman, the ovulation generally occurs on from day 12 to day 16th. Now, the sperms, after depositing into the vagina, will survive for approximately 24 hours, and the ovum also, after release, it will survive for about 24 hours. So, the entire fertile period in a woman who has 28-day cycle is between 11th and 17th day of the menstrual cycle. So, if coitus is avoided during this period, then they're unlikely to become pregnant, the woman. Now, so the safe period is from day 1 to day 10th and from day 18th to day 28th. But please remember, this is applicable only if the woman has regular menstrual cycle, regular 28-day cycle. Now, many people do not have regular cycles. There, it is a bit difficult to predict the fertile phase with the calendar method. Now, the second way to predict the fertile phase is mucous method. Now, mucous method, here, the characteristic of the mucus is what decides when ovulation occurs. See, the mucus changes due to estrogen and progesterone effect. Now, the effect of estrogen is that the mucus becomes profuse, increase in quantity, slippery, elastic, and it becomes stretchable, what we call a spin Barkit sign, stretchability of the mucus. The effect of progesterone is that the mucus becomes very little, becomes thicker, and becomes scanty, and forms like a mucus plug in the cervix. Now, in the proliferative phase, when the Graafian follicle is growing, more and more estrogen is released, and at maximum is reached at the time of ovulation, just prior to ovulation. So, when the mucus starts appearing, and till the 4th day after the peak of mucus secretion is reached. If during this time coitus is avoided, then pregnancy is unlikely to occur. So, abstinence from day mucus is detected till the 4th day after the peak mucus production is detected. So, this is the mucus method. Then the third method is the temperature method. That is where basal body temperature is recorded. Now, the effect of progesterone on the body is that it increases the body temperature, thermogenic effect. So, by about half degree centigrade. So, if body temperature is recorded every day on waking up and plotting the readings on a graph, then the day the temperature shift occurs, it means that is the day of ovulation, and from that day, coitus can be avoided. But this is one device by which you can see the temperature is recorded in the device, and the day is also recorded. This is again another method where you can find out the uh, fertile phase of the menstrual cycle. This is only a picture, that's all. This is not a device. Then the second method is the natural method is the coitus interruptus. Now here coitus takes place normally, but penis is withdrawn immediately before ejaculation so that the semen is not deposited in the vagina. But this is a very high failure rate is there, 25 per 100 women years, which is very, very high and unacceptable, because the prostatic fluid secreted just prior to ejaculation also contains sperm sometimes. And so these sperms may cause fertilization and pregnancy. But the advantage is that there's no cost involved, no device is needed, no side effects of any device or method, no contraindications, there's no effect on lactation. In other words, it should be ideal, but the main disadvantage is that a very high failure rate is there, and it puts a strain on the husband. Wife may not enjoy coitus, and there's no protection against STD and HIV, that is sexually transmitted disease and HIV infections. So this is again failure rate is high, not the ideal method. Then breastfeeding. A woman after delivery, when she starts lactating and breastfeeding is done, regular full breastfeeding with at least one feed at night, pregnancy can be prevented for 6 months. And a very low failure rate, you can see it is only 0.5 to 1.5 per 100 women years. Now, how does this prevent pregnancy? Because during breastfeeding, prolactin is secreted from the anterior pituitary. You know, the gonadotropins are also secreted from the anterior pituitary, and ovulation occurs when the LH surge occurs in the at the time of ovulation. Luteinizing hormone suddenly increases rapidly, very high level is reached, and this stimulates release of ovum from the Graafian follicle. So when prolactin is secreted in high amounts, it prevents the LH surge, so ovulation does not occur, so pregnancy does not occur. This is a very good method, and absolutely no cost is involved. Breastfeeding, and very good for the baby also, because baby gets good nutrition. So all these temporary methods, the first two methods are not ideal, high failure rate, but there are many couples who have been following one of these methods and have avoided pregnancy for a number of years. Now let us go to the methods where some device is used. I will first talk about barrier methods. Now barrier methods, male condoms. Now male condoms, they are made of latex, vinyl, tactylon or polyurethane. They may be plain or they may be treated with spermicidal. Now, if treated with spermicidal, additional protection, because sperms, even its little sperms that are deposited, can be destroyed. Water-based spermicidal is better because oil-based spermicidal agents damage latex. Now you get them in different colors. Uh, Now, how to use this? See, most of the time the failure with male condoms occurs because it is improperly used. Now, how to use it? What are the directions? It should be used on the erectile penis just prior to penetration. It should cover the entire length of the erect penis. A reservoir is left to retain the ejaculate. Here you can see the reservoir at the tip of the uh, condom. Now, yes, deposited semen collects in that. Then, adequate lubrication must be used, otherwise it becomes painful. Usually, most of these condoms are pre-treated with lubricants. Then, penis must be withdrawn before the tumescence. Otherwise, the condom will remain in the vagina and spillage of the semen can occur. And while removing, the rim of the condom should be held firmly to prevent spillage. And of course, condom should be suitably disposed of after use. So, if used correctly, it is a reasonably good method. So, what are the advantages with this male condom? It prevents STD and HIVs. Then it prevents sperm allergy and formation of sperm antibodies. That is, in some men and women, what happens is antibodies are formed against the sperms in the body, antibodies. The immune system in the female will produce antibodies which will then destroy the male sperms. So, if these sperm antibodies are responsible for infertility in this couple, then using this condom for a short period will prevent or at least suppress the formation of the antibodies temporarily, and then immediately after discontinuing use of this condom, if they have coitus, the woman may become pregnant. So actually it can be advised as a part of infertility treatment also. Then other advantages: it is easy to carry, it is inexpensive, available everywhere. Then there are no systemic side effects because the action is only local. There is no interference with menstruation. It can be used with other methods like using spermicidal agents to enhance protection. Then it does not adversely affect if the method fails and the woman becomes pregnant. There is no effect on the pregnancy. The fetus is going to be normal. And if male involvement is there in contraceptive effects, so the male also takes some responsibility for prevention of pregnancy. Then carcinoma cervix is low in the partners of people who use these condoms because it not only prevents a deposition of the sperms in the vagina, it also prevents entry of other viruses. You know, carcinoma cervix, human papilloma virus is responsible for this. So the HPV virus entry into the cervix is also prevented. So carcinoma cervix is low in the partners who use uh, condoms. But then there are disadvantages, like sometimes a latex allergy may be present. Then male partner may be unwilling to use it because uh, there is maybe interference with spontaneity of a sexual act and less sexual satisfaction. This may frequent complaint from the males. The possibility of a breakage, slippage, and leakage can occur. Then the semen gets deposited in the vagina and sperms can ascend up, and then fertilization can occur. And it is not reusable, only single use. And it has to be used with every act of coitus. Say some methods, one say, for example, IUCD is inserted in the uterus, then for 5 years it can be just left behind, and every act of coitus, when there is no need for a fresh insertion of IUCD. So, but with the condom, every act of coitus, this condom has to be used. So, because of all these problems, especially the breakage and spillage, etc., pregnancy rate is high. That is, the failure rate is a bit high. It may be as high as 10 to 14 per 100 women years. Right. Then, occlusive diaphragms. These are barriers that are placed in the vagina. It forms a barrier against insemination by the sperms. So, here, though the semen is deposited in the vagina, the ascent of the sperms up, upwards into the cervical canal and uterus and fallopian tubes is prevented because you are placing a barrier in the vagina. These sperms are prevented from ascent. So, and this is again more effective when combined with other methods like spermicidal agents. Diaphragm is covered with spermicide, can be inserted at a convenient time. Convenient time ahead of coitus. So, but not too far ahead, just maybe a few minutes or a half an hour like that. Then and it has to be left in position for a minimum of 8 hours after coitus, because if it is removed immediately after coitus, some sperms may be still left in the vagina, and then fertilization can occur. Then changes in the weight of the woman, any illness or recent delivery, and or presence of gynecological conditions such as prolapse can cause change in the size and type of the diaphragm. It may become loose. So what happens is it may come off, fall off, or it may not provide adequate barrier function. So pregnancy can occur. So it has to be changed after any illness or a delivery, etc. Then that is why periodic checking must be done at intervals, at least from 6 months to 1 year, and refitting should be done if necessary if the size has changed. Similarly, if the woman had a recent delivery, 6 to 8 weeks after delivery, refitting of the diaphragm has to be done. Now, so that is generally about the diaphragm. Now, what are the specific types of diaphragm that are available? One is the Dutch cap. This is a dome shaped, and it is, see, this is the one. This is the diaphragm. You can see it is dome shaped. There is a rim, uh, which is which has the rolled edge. So it is a dome shaped made of thin rubber and a rubber covered rim. There is a spiral spring inside this rim which is covered with rubber. Now the spring, because it is a spring, it can fit tightly in the vagina without becoming loose and without being expelled. Various sizes are available, like from 50 to 95 millimeters diameter. It fits obliquely in the vagina from behind the pubic ramus to posterior fornix, so covering the cervix. It is placed in such a way that the convex edge comes down and the uh, concave surfaces faces the cervix. And it is held in position, I told you, by the tension of the spring in the rim. Now, which conditions is it contraindicated? Wherever there is some abnormality in the vagina or in the cervix, it is better not to use this Dutch cap because it may increase the condition or it may not fit properly. For example, there is a prolapse and a cystocele and a rectocele. These are conditions where the vaginal ligaments and the muscles of the floor of the pelvis, they have all become loose, and so the vagina descends down, and the cervix and the uterus also descend from its normal position, may come down into the vagina or even come out of the vaginal introitus and visible outside, that what we call a prolapse. So here the entire vagina is very roomy and loose. So with the available sizes, it may not be fitting properly. The diaphragm may not fit properly across the vagina, and failure of the method can occur. Then, if the woman has recurrent urinary tract infections, see, sometimes this, because this is placed across the vagina and fits behind the pubic ramus, sometimes it may obstruct the urethra and residual urine may be there and infections can occur, urinary tract infections. So, if the woman is prone for recurrent urinary tract infections, this increases the chance for the infection. So, this is not the ideal method in this woman. Then, if the woman has allergy to the rubber or to the spermicidal agent, again this cannot be used. Sometimes complications, serious complication like a toxic shock syndrome, particularly if it is left behind for some time, for few days, and then infection can occur and the patient can go into short toxicity, and then toxic shock can occur. Now, the failure rate is also slightly higher, not as much as the male condom, but it is 4 to 6 per 100 women years. So, that is the Dutch cap which fits across the vagina. See, here you can see the this is the cap. It is fitting across like this, across the vagina. This is the vagina. Above this is the cervix. Now the spermicidal is the sperms. See the sperms? Sperms are trying to go ascend up, but this diaphragm is preventing the ascent of the sperms. And these are the spermicidal agent. If you put, some of the sperms also will be destroyed. Now this shows the various types of diaphragms. Now this another diaphragm is the cervical cap. This cervical cap is a cup-shaped rubber made of rubber and with a rolled rubber rim. Now it fits closely to the cervix. It is not fitting across the vagina, but it is applied to the cervix. It fits closely to the cervix. See here, you can see it. The arrow is showing the cervical cap fitting onto the cervix. It is not lying across the vagina. It is only fitting onto the cervix. So it is useful when the cervix is long and firm. Like in prolapse cases, prolapse of uterus and vagina, because there is no need to put it in the vagina, it is useful and it fits only onto the cervix, so it is useful in these conditions. Now, what are the contraindications? Any condition where there is some lesion on the cervix, like infection is there, chronic cervicitis, erosion, or lacerations of the cervix. Because if lacerations are there, it will not fit properly on the cervix. Then pap smear is abnormal. You have to rule out the abnormality, you have to treat the abnormality, and then only you can use this. And also, it is not very useful if the cervix is too long, because it will not give adequate protection. If it is too short, it will not fit properly. Again, if it is asymmetrical with lacerations, it will not fit properly. Four sizes are available: 22 to 31 millimeters. That is the diameter of the device. Now, female condom. It is also called FemShield. Female condom is the female barrier contraceptive. Just like a male condom, this is a female condom which is inserted in the vagina and prevents pregnancy. It is woman oriented in the sense that the woman can insert it herself into the vagina. She can decide what contraception she wants and then she can insert it into the vagina. It is a loose fitting device. It is about 15 to 17 centimeters long. It is made of pre-lubricated polyurethane. It's a long, thin sheath. It has two. This is the picture you can see. There are two ends. One is the closed end, one is the, this is the closed end. This is the open end. Both have rings at the ends. And this length is about 15 to 17 centimeters. Now, closed end has a ring, and this, why should there be a ring at the closed end? So that you can, it serves as a guide for inserting the device into the vagina, for anchoring it in the vagina. Then the open end lies outside the vagina after insertion, and it covers the even external genitalia. So the condom, this female condom covers the vagina, cervix, and external genitalia. Now, even this semen deposited in the vagina, but it is prevented from reaching the cervix. Even the vaginal walls are protected here. See, this is how it is inserted. You can see the closed end, the open end, and after insertion, how it is lying in the vagina. You can see this is the closed end, which is fitting across like this in the vagina, and the open end lies outside the introitus. It covers the external genitalia also. Now, how is it inserted? The pouch is held with the open end hanging, and then spread the labia with fingers one hand, and using the thumb and middle finger of the other hand, the inner ring is squeezed into an oval, and then this is with the index finger as a guide, the inner ring and pouch. It is inserted deep into the vagina. And how is it removed? Removed after intercourse, soon after intercourse, by traction on the outer ring. Now, what are the advantages of this method? It is coital independent. That is, it can be inserted well in advance of sexual act, not just at the time of sexual act or just before. Any time before, the woman can herself can insert it. So she can protect herself. Now, and it does not slip off easily because there is a ring at the other end which is fixed across the vagina. And it is stronger than the male condom. It does not burst easily. And it can be used easily in the pubertal period also, where the vagina is very roomy. Now, but what is the disadvantage? Failure rate is similar to the diaphragm and other devices, 5 to 15 per 100 women years. But the main problem is it is expensive and it is not reusable. It is a single use one. So an expensive device for single use, people may not be able to afford. That is the main drawback of this method. Today, today is another method. Today is actually the trade name. It is a sponge. It is a polyurethane sponge made of polyurethane. It's mushroom shaped, 2 inches in diameter and 1.25 inches thick. It contains 1 gram of nonoxynol 9. That nonoxynol 9 is a spermicidal agent. It is incorporated into this sponge. And on the convex side, it has a loop for easy removal. Now, it is placed high up in the vagina with the concave side facing the cervix and convex side down. It is effective for 24 hours, uh, but it is not reusable. It prevents entry of sperms into the cervical canal by how semen is deposited in the vagina, but the semen is absorbed by the sponge, and then it also contains spermicide, so these sperms are killed in this sponge itself. Failure rate is again a bit high. It's about 9 to 30, 100 women years. Disadvantages is that it is again expensive and it has to be used at the time of coitus, coital dependent, and it is single use. And if forgotten and left behind, it can again cause toxic shock syndrome. It can get infected and cause generalized septicemia in the woman. Now, spermicidal agents. Spermicidal agents are agents which kill sperms before they enter the cervical canal. There are various chemical agents which kill the sperms. They contain surfactants like nonoxynol, octoxynol, menfegol, and some enzyme inhibiting agents, etc. They are available as foam tablets, soluble pessaries. Pessaries are like tablets, but they dissolve in, so they are soluble pessaries. Then they're available as creams, jellies, and also along with the other devices like condoms and diaphragms and cervical cap, they're available as films, coating these as film, coating the condoms. And effect lasts for about 1 to 2 hours after application. So it has to be used with each act of coitus. At the time of coitus, it is coitus dependent, and if used alone, it's very high failure rate, 30 per 100 women years. So most of the time, these spermicidal agents are used along with the other devices like condoms, diaphragms, etc. See, these are the few of this available. You got the foam, and then you got the suppositories, which can be used. This is a applicator for cream or for the placing the suppositor also. Suppository is like a long tablet. It is placed on this applicator and then inserted in the vagina. Now, what are the advantages? It is easy to use. It acts locally only. It is not absorbed into the body, so general side effects are not there. So then there are no contraindications. It also offers some protection against STDs, that is sexually transmitted diseases, because it is kills the sperms. It can kill some of the viruses and bacteria also, but not complete protection. Then antiviral properties of nonoxynol, it can also kill some of the viruses. So some if HPV is virus is killed, then risk of cervical cancer is also less. So that way some protection is there, but not complete protection. But the main disadvantage is the high failure rates, 30 per 100 women years is definitely not acceptable. So it cannot be used alone. And what are the disadvantages? Local irritation is there, local allergy can occur, high failure rate, then incomplete protection against sexually transmitted diseases. Effect on HIV is not clear, but see, the HIV virus may be killed. You may think HIV infection incidence will become less, but then because it can cause local irritation, suppose local irritation is there, vaginal ulceration can occur, then more of the virus can be enter into the body, and the risk of transmission of disease is high. So the effect, you cannot say, it can be either it may decrease in some or it may even increase the transmission. Then some people find it messy because it is a cream and all that. And they think it is interrupts with the spontaneity of the sexual act. And it has to be repeated at every act of coitus. So these may be some of the disadvantages. Now, intrauterine devices I'll deal with in the next class because that's a very big topic. I do not want to start it and then stop it in the middle. So, any doubts you have, you can please ask me. Yes, what is this complete silence? Otherwise, I will start the other topic because a lot of time is still left. Okay, intrauterine devices. What are intrauterine devices? It's a device where a small uh, device is inserted into the uterine cavity, and this prevents pregnancy from getting implanted, fertilized ovum from getting implanted in the uterus. It is a reversible method, no doubt, because once the device is removed, the pregnancy can occur. And there's no need for any replacement for a long period. It need not be used again and again, not need no interference with the sexual act. It need not be used with every sexual act. It is made of polyethylene. Polyethylene is impregnated with barium sulfate. Now, why is it impregnated with barium sulfate? You know, barium sulfate is radio opaque. So, if this IUCD becomes misplaced, taking an X-ray, you can see the opacity of the device and then know where the device is, whether it's inside the uterine cavity or has it come out of the uterine cavity. Then you have also got medicated devices which may contain copper or which may contain hormones like progesterone, etc. There's a nylon thread attached at the lower end of the device. This protrudes from the cervical os into the vagina so that by looking at the thread, nylon thread, or patient can herself feel the nylon thread, and if she feels or if the obstetrician examines and sees the nylon thread, it means the device is inside the uterine cavity. It is not misplaced. So this thread has been added to know the position of the device, for checking on the position of the device. Now, how do you classify these intrauterine devices? They are historically they were biologically inert devices. Olden days we had, say, 40 years back, Lippis loop and safety coil. They are not used anymore. So you can forget about them. Now we have got copper containing devices and also hormone containing devices. Now, the copper carrying devices are where a copper wire is wrapped around the vertical stem of the polypropylene frame. It is the device is made of, is like a frame. See, you can see the device here, various shaped devices. This is the IUCD which is inserted into the uterine cavity. The nylon thread you can see coming from the lower end. Now you can see this is brown one is the copper wire. Here it on the vertical stem it is wound here also. Okay. Sometimes in the copper 380A it is insert wound around the horizontal stem also. Now, so this copper wire is wrapped around the vertical stem of the frame, And the effective life is, that is lifespan of this device is 3 to 10 years, depends upon the amount of copper wire that is wound around the device. Now you have got copper T200, which has 120 milligrams of copper, and the surface area of the copper wire is 200 mm. So the device is named after the amount of the surface area that is present. So if the surface area of the wire is 200 mm, we call it a copper T200. Copper T200B is 124 milligrams of copper, and the surface area is 215 mm. Then copper T380A, this is the government supply that is available, 380A. Here the copper wire around the stem is 176 milligrams, and the copper wire around mid portion of both arms is 66.5 milligrams, and the surface area of the wire is 380 mm. So it's called copper T380A, and it can be left behind in the uterus for 10 years. It can give protection against pregnancy for as long as 10 years. Then multi-load is another device which has the surface area of the copper wire is 375 mm. So it's called copper multi-load 375. Now the other group is the that are available now are the hormone carrying devices. These hormone carrying devices contain the hormone progesterone. Now the type of progesterone may differ in each device. Most common one is the levonorgestrel, is the progesterone that is present in the device. Now, this is present in the, there is a reservoir in the device. In a vertical stem, there is a silicone oil reservoir in which the hormone is present, and a certain amount of hormone is released every day, small amount of hormone in micrograms only. So that then acts on the endometrium locally and prevents pregnancy. See, progesterone is released in the uterus and it forms a thick plug of mucus in the os. I told you when I was talking about mucous method of knowing the fertile phase, that the effect of progesterone is it thickens the mucus. Mucus forms like a thick plug in the cervical os. So this thick plug can prevent some sperm penetration. And progesterone also has a local atrophy of the endometrium, which prevents implantation. So there is various methods by which this progesterone prevents pregnancy. Now, the various types of these hormone carrying devices, you got Progestasert, which is a T-shaped device. There are 38 milligrams of progesterone is there in the reservoir in the vertical stem, and 65 micrograms of progesterone is released every day. And this effect of this hormone lasts for about 1 year. That is, this amount of hormone that is present lasts for about 1 year. So the protection is there for 1 year. Then you got the Levonova, which contains 60 milligrams of levonorgestrel. It releases 20 micrograms of levonorgestrel every day, and the effect lasts for about 5 years. Failure rate is about 0 to 3 per 100 women years. Then you got the Mirena, which is the most common one, which is commercially available in our country and which is used extensively, Mirena. This device contains 52 milligrams of levonorgestrel. It releases 20 micrograms of levonorgestrel every day. The failure rate is about 0.1 to zero point 0.4 per 100 woman years. So you can see very, very low failure rate. Compare this failure rate with the failure rate of a male condom, that is about 10 to 14 per 100 women years. This is only 0.1 to 0.4 per 100 women years. So IUCDs and oral contraceptive pills are very highly effective, and both are failure rate is almost similar. And the latest ones you got frameless devices, which still are not available commercially, which are still in the experimental stage. They contain several copper cylinders are there, which are tied together on a string and then anchored deep into the fundus. This string of cylinders actually hangs in the uterine cavity. And because of the presence of copper, copper causes enzymatic changes in the endometrium and pregnancy is prevented. These are the various devices you can see. Actual size of the device is very, very small, 3 to 4 centimeters, that's all. This device. This part, this is nothing but the applicator, the inserter actually. With the help of this, we are inserting this device into the uterine cavity. So this is the actual device which will be in the uterine cavity. These again different types of IUCDs you can see. You can see the first one is it's got a, this is the copper containing, this is the copper. This is the marine IUCD. You can see it is thicker than this one. This is the reservoir which contains the hormone. This is again a copper containing device. Now, how do you select the patient? Which patient can use the IUCD? There should not be any local infection, because if you insert when there is infection, then the infection can spread upwards to the fallopian tubes and into the peritoneal cavity, and then the patient may become infertile also later. And she should be a low risk for any sexual transmitted diseases. Then a multiparous woman. See, in a nulliparous woman, we do not want to place a device in the uterine cavity, because if it is not done under complete aseptic conditions with all precautions, then infection may be introduced into to the fallopian. It may spread tubes, and the tubes can become blocked, and the woman can become sterile. So we do not want to insert it into a woman who did not have any children. So a woman who has already had 1 or 2 children, we can use this. Then the couple should be in a monogamous relationship, because otherwise infections can be there, and then spread of infections can occur. So a couple who is not ready for sterilization but wants a long-term method, get it the device inserted and forget about 5 years, 10 years, depending on the depending on the device. And they are not reliable users of other methods like condoms or diaphragms. They are not able to use properly. They're unreliable, and failure will occur. So this device can be inserted. In such a patients, this can be chosen. Okay, I'll end it here. Next, I will continue in the next class. Anything you want to ask? Should I ask you some questions? Yes? What is the failure rate with male condoms? Anybody wants to answer?
Ten to 14 per 100 women years.
Yes, very good. What is the failure rate with spermicidal agents? Highest failure rate when used alone. It's 30 per 100 women years. Okay. At least you have been listening. I'm happy. Okay, I'll end the class. Thank you.